Sanso. I'm a director at ARA Diagnostic Imaging. I am lucky enough to just have my 40th birthday. It's the time I'm waiting for. I am officially of age and can have my first screening mammogram. So that is officially scheduled for tomorrow here at our ARA Cedar Park office. And I thought it would be kind of fun to let you guys go through the experience with me. I hope to answer some of your questions about screening mammography and get you to be able to experience this with me. So then hopefully you will go out and schedule your screening mammogram. Or if you've already had yours, maybe you have a family member, a mom, a sister, an aunt. Have they had their screening mammograms? I know from my career that early detection is incredibly important to diagnose early breast cancer and give you the best chance of survival. And that's what I'm here to help myself do, and I hope help you do. So what I've done so far is I went and saw my family care doctor. He gave me an order to have my screening mammogram so I can file with my insurance. I went online and I was able to schedule my appointment really quick and easily, so that was really fast. And now I have the prep instructions from their online system that told me no lotion, deodorant, or powder under my arms or around my breast area. Not really sure why that is the case, so we're going to ask Dr. Saravanan that question. So today we get to meet with Dr. Saravanan. She is the head of the breast section for ARA. She is going to answer some of my questions that I have before my mammography, and hopefully will answer some of yours. Dr. Saravanan, why is it so important that I get my mammogram?
Well, first of all, Stacy, I'm very proud of you for taking this very important step in your health and your overall kind of management. It's, sometimes we just forget about doing some of the basic things that are so important. So good job.
Thank you.
Why it's so important? Well, our breast health is something that we can easily forget about or ignore, but it's so important because these breast cancers that we detect, if they're found early, they're just much more treatable and sometimes curable compared to some cancers that we find at a later stage.
I know some of the area employees that have been diagnosed with breast cancer, and that's always been something that is super aware of for me because there were some managers that kind of waited till later and they got diagnosed much later, and I know their treatments were really, really tough on them. So It's been something I've honestly kind of been looking forward to. And it was weird, but in a sense, I'm kind of really anxious about my healthcare.
Sure.
And so knowing that I'm okay is better than wondering.
Absolutely. So, and that's actually right along the recommendations of the American College of Radiology. And, we follow the guidelines of the ACR, and they recommend that all women should get their first mammogram starting at the age of 40 and yearly thereafter.
So yearly, though, because I saw something on social media recently that said that the guidelines had changed and I should have them every 2 years.
There's some conflicting evidence just with different groups, but what we follow is the American College of Radiology guidelines, and they do recommend a yearly mammogram. And the reason for that is, they have found the detection of breast cancer to be much higher in patients who have yearly mammograms than every other year. Yeah, so in general, breast cancer is just treatable and detected earlier if it's done every year versus every other year.
So something I was really excited about was when ARA did the investment in replacing all of our equipment into 3D mammography. I know that was probably the biggest advancement in mammo history for quite a long time, probably since digital mammo, right? Mm-hmm. So what is the difference between that 2D mammography and the 3D, and why is that more valuable to my healthcare?
Yeah, great question. 3D versus 2D, it almost feels like a long time ago that we did this, but it is our standard of care now.
Yeah.
The 3D mammography units is what we call tomosynthesis imaging, which is kind of the cutting edge technology that can detect cancers at a much better rate than the 2D technology. And also our recall rates are much lower, meaning the number of times we have to call patients back for additional imaging is much lower with 3D mammography than it is for 2D. So it has proven in several different testings and in several different kind of experiments to kind of be superior to the 2D technology. And this is why we implemented 3D mammography across the board in ARA.
Gotcha. My mom had that experience because she used to get called back every year because she has fibrocystic breast and something would show up. And this year was the first year she didn't get called back. And she was like, I don't want to do this year. And I'm like, that's great, Mom.
It's nice. It's nice when you don't have to come back.
Right.
Of course, that call can be anxiety provoking too. When you're like, oh no, they called me back. There must be something wrong. So this definitely alleviates that anxiety and it makes you feel more comfortable and, just more trusting in the care and in mammography in general.
Yeah, that's awesome. The way that they explained the 3D imaging to us compared to the 2D was like, it's like a loaf of bread, and they're dividing that loaf of bread into slices, and that you can take out each of those slices and look at them to be able to find breast cancer better.
And look at it better. Yes. Okay, exactly how we do it. So when a radiologist is viewing the images, typically when you think about a CAT scan, you're scrolling through images and it's going from the top part of your body to the bottom.
Right.
Very similar with 3D tomosynthesis imaging. You're basically going from the top of your breast to the bottom and you're kind of scrolling through different images. And what can't be caught on just a 2D image, which is essentially just a picture, just like we would take with our cameras, this can capture at a much better kind of accuracy and detail. So
that's amazing. It's cool to be a mammographer as a radiologist, I'm sure, and kind of go through that transition of seeing 2D and then transition into 3D. I can't imagine how much that's changed
It's been fun. It's definitely evolving, but with radiology, we're at kind of the cutting edge of all technological advancements. So it's really been great.
That's one of the things I've always been really proud of working for ARA is always feel like we do a great job of staying on the cutting edge and really investing in our patient care by investing in equipment. So I applaud y'all for making those kind of decisions. I think that shows a lot of how much our radiologists care about our patients. And even though you don't necessarily get to see every patient, like you get to see me, I know that you always put those patients first through those decisions that y'all make. So thank you for making great decisions.
Thank you, Stacy. Appreciate that. And you also definitely couldn't have done it without all of our support and stuff like you. So appreciate what you do as well.
Thank you. Thank you. That's awesome. So I've scheduled my screening mammogram for tomorrow during lunch. So super excited to my first one. I know, make the most of my time. I scheduled the appointment. It's going to go to my family care doctor. I know in general what to expect on the outside of the door since that's what I'm used to seeing, but what can I expect when I come in and actually have the exam done?
Yeah, great question. So, when you initially come in, you'll just check in at the front desk. They'll process paperwork. You'll be taken back and you meet with Kim. She's one of our certified mammography technologists. She will take you to a 3D mammography room and you'll get your mammogram done there. It'll take less than 15 minutes to get it done. So you can definitely get it done in your lunch hour.
Nice.
And then the results will go to your doctor after the screening mammogram is read by the radiologist. So it should be fairly seamless process.
Yeah, my doctor told me that they don't really call me with the results anymore. It's all on the computer system. Everything's electronic now. So I can log on to my ARA portal and see my report. I can log onto my doctor's office portal and see my results. So it's really nice to be able to get that information really quick and have it available at my fingertips without having to go back for another appointment to find out what the results are.
That's really nice. They make it very easy. And it's nice that you can, you don't have to wait. You'll get the results right away when they've been read. And of course, if you do have any additional imaging that's needed, that's when you would, have to call in to schedule for any additional imaging. So,
right. Absolutely. What is a screening mammogram?
That is a great question. We just assume that everyone knows what these are. So a screening test is a test that or an exam is an examination that we do to ensure that we are kind of doing something preventative. So similar to kind of a colonoscopy, of course, I don't want to compare mammography to colonoscopy. It's kind of a similar type of exam that, we know that there's nothing that is a concern right now, but we're screening the breast to see if there's a concern that needs to be evaluated. And, the reason we do this is because as women age, many studies have shown that the risk for breast cancer increases over the age of 40. And that's why there is this recommendation of getting your screening mammogram once a year after you hit 40. The chances, though, of getting breast cancer are pretty low after you do get your screening mammogram. So 1 in 8 women will be diagnosed with breast cancer in her lifetime. But the good thing is more than 98% of these cancers are treatable if they're detected early. And that's why we emphasize kind of early detection by breast cancer. by mammography.
I've heard that some types of breast cancer are super aggressive. And so from 1 year to the next, you can actually find a pretty significant breast cancer, even waiting a year. So I can't imagine waiting 2 years. I know during COVID, that was a huge thing with people kind of putting off their screenings. And maybe some women even haven't had their screening since before COVID. And that's definitely increased the amount of breast cancers that we're seeing now.
Yeah, I mean, it has. I think we did see a rise in patients coming in right after the pandemic was, we were officially allowed to go back out in the public. But the chances of getting breast cancer once you're screened is fairly low. So just to give you a perspective, out of 1,000 women who get screening mammography, 100 are called back for additional imaging. And out of those 100, we only have 5 breast cancers that are found. So it's actually a very small number of women that actually are diagnosed with breast cancer compared to the numbers that are actually screened in a year.
Gotcha. And for what reasons would I get called back for additional imaging? Like, what did you find? Or what are you looking for? What's suspicious?
Yes. So, typically what we look for is we're looking for something called focal asymmetries or architectural distortion, which just means the tissue I'm looking at looks different from the surrounding breast tissue. And sometimes it can also look different from the other side. Now, of course, if you have mammograms done in previous years, we always compare to mammographies or to mammograms done on years prior to see if there's any changes. The other thing we call patients back for is calcifications. Now, most of the time, calcifications of the breast are benign. We see them very commonly in women of all ages. Sometimes, though, they can reflect a precursor to malignancy. So we tend to evaluate these further as well to make sure they're not something that are suspicious or concerning.
So if I get that call back, I shouldn't immediately freak out because chances are it's a very small possibility that it's cancer. But it's important to get additional imaging for, and that will help me in my future mammograms as well, because then you'll know what they are if they are still present on future mammographies as well.
Yes, exactly. So say we called you back for a small group of calcifications this year, and we've evaluated it and deemed it to be just benign, and we return you back on a kind of routine yearly screening mammography schedule. The next year, we see these calcifications again, we don't have to call you back that year because we've already looked at it and evaluated it. So it does kind of decrease the chances for callbacks for future years. But of course, given that this is your first mammogram, we just have to wait and see.
Absolutely. I've heard that mammograms are very painful, that the compression can hurt a lot. Is there anything that I can do to help prevent the pain or to make it hurt less? Or what causes the pain in the first place?
I'm so glad you asked that question. And, that is definitely a myth that's out there. It's a lot of people just talking about, oh my God, the compression is so horrible. But most of the times when we've talked to patients after they get their mammogram, that myth is definitely dispelled very quickly. They usually say that it's not as bad as what they've anticipated. And I would say it's mostly fear of the unknown, just not really knowing what to expect. And this is why, we're chatting about this earlier, so that you do kind of understand the process. And yes, there is a little bit of compression with the mammography paddle, and it's not every day that you have your breast under compression. So it's not going to be the most, comfortable.
Right.
But it's also not an excruciating pain. We don't, recommend any additional medications or anything like that. So it's just for a couple of minutes that you're actually kind of experiencing compression in your breast, and there's an image taken. And the reason we do the compression, perhaps it'll help alleviate some of the tension, is that we're able to get much better contrast detail within the breast tissue if the breast is under compression. So, if we just take a picture, an X-ray of your breast tissue, when it's not in compression, we're not able to see those asymmetries, calcifications, and distortions as well as if your breasts were in compression. And, of course, lots of studies done with this and what is the ideal amount of compression and, how much contrast is required to actually get a good visual of the breast tissue have all been done. And we've, optimized it so that it is comfortable for the patient, but it's also enough for the radiologist to be able to interpret it.
Gotcha. I was told that I cannot wear deodorant before my exam. So since I'm having an afternoon exam, I'm just curious, why does deodorant matter? Why should I not wear deodorant?
Yeah, I mean, great question. We typically advise against deodorant because I was telling you about these calcifications that we look for in the breast. So a lot of deodorants actually need these residual calcifications on your skin surface. And if you imagine when you get this x-ray, we do cover a lot of the axillary tissue, which is the underarm, which is, typically where the deodorant would go. And we've found a lot of times that there's calcifications left behind by this deodorant if it's not cleaned off or if it's worn. And we have to call these patients back. And so to avoid these additional imaging, to ensure that these calcifications are just on the skin surface and not within the breast tissue that are more concerning, we ask our patients to either clean deodorant or not wear it.
That makes sense. And I had no idea that the breast tissue went so far up. Yeah, the arm. That's amazing.
We call it axillary tissue. It's very much part of the breast tissue. Sometimes we'll have accessory breast tissue within the axilla. But we also look at the underarm because there's lymph nodes that live in that area. So we need to kind of look for if there's any processes or any changes in that area as well. So
gotcha. That's amazing. Thank you so much for answering all my questions. I know I've been in radiology for over 20 years, so it feels like I should know all these things as well as you do by now. But it's really reassuring to be able to have a conversation, to be able to share with my friends what to expect and what's going on and what I really can prepare to do when I come in to take good care of my health tomorrow. So
absolutely. You're so welcome. Absolutely a pleasure. Good luck tomorrow. I'm sure it'll look great. And I'm sure we'll connect afterwards to talk about what the images actually look like.
Thanks. Thank you so much.
You're welcome.